The MedStar Health System Administrative Fellowship Program is ideal for a candidate that is looking for a very broad range of experiences, for somebody who's looking for access to all levels of leadership, maybe someone who isn't sure if they want to be at the hospital or at an ambulatory surgery center or at a medical group practice. It's perfect for somebody who is really looking to taste every piece of healthcare that there is to experience.
The beauty of the fellowship is that it is self-guided, and that means that the fellow has a lot of input into the types of things that they want to learn and be directly involved with. Yet you're not on an island. You're in a structured environment.
MedStar Health System Fellows are able to go to parent board meetings, hospital level board meetings, leadership team meetings at the system level, as well as at the individual hospital level. They get to see and experience really anything that they want. Some people sort of perceive that to mean that there's not a lot of direction and there's not a lot of support or guidance, and it's the total opposite. This program is really just built and packed with supportive leaders and mentors that are committed to helping you grow as an individual and as a leader, but also allow you to have the experience that you want to have.
I always had a passion for hospital operations, so to be able to tie it back to the patient level and the frontline associate level and the nurses and the physicians at the local level and how that tied back to corporate strategy was really a unique experience to be able to really put all the puzzle pieces together in my mind for such a large enterprise.
I'm very grateful for the network that I still tap into to this day and intend to for the rest of my career. The MedStar Fellowship really is set up where the doors of all the leaders are open to you, and it's on the fellow to establish those relationships, but those leaders are well open to receiving and serving in that mentor role. So thinking about where I was as a student coming into the fellowship program and where I am now, 9.5 years later, I'm much more confident, primarily just based in my skill set and knowledge base. I have a list of accomplishments, and all these experiences will help shape the trajectory and direction of the rest of my career.
As the administrative fellow, you have the opportunity to meet with Ken Samet on a regular basis. And I was meeting with him one day, and we were talking about the MedStar Health footprint. And he had, in his conference room at the time, he had a map of the area. There were points on the map of all of our locations, and then there were points on the map with other hospitals and other health systems locations. He said, "Where would you put one of our locations?" And I had a very narrow view of the world. I pointed somewhere on the map, and he said, "Think again about it." He really coached me through how you make decisions, and he was really interested in my perspective, and that was phenomenal.
Kind of pinch yourself sometimes, and as you're sitting around the boardroom with corporate executives and board members and a variety of other folks, it truly is a unique experience that you're just a sponge for that year.
I'm always proud to see how each of the fellows flourishes over the course of the year, see how they come into the organization, be constantly partnered with them across the course of the year, and then seeing the type of leader and the type of healthcare understanding that they have at the end of the year is very powerful.